This week's Ask Dr. Durie is an interesting question. It comes from a patient who had gone in to see her doctor and ask about the discovery of monoclonal gammopathy of undetermined significance, what we call MGUS. The doctor had said that MGUS has no symptoms and so not to worry. The question from the patient is this true? Well, actually, the answer to that question is no. MGUS patients can indeed have symptoms that come from the presence of this abnormal monoclonal protein in the blood. These proteins can be sticky, they can have what we call affinity, where they bind to different tissues and can cause a variety of problems. For example, even although no myeloma has developed, the constant production of an abnormal protein can bind to cells in the kidney and cause kidney damage. Sometimes these types of monoclonal proteins can bind to nerves. And so these are the sorts of symptoms that can occur. There can be symptoms related to kidney damage, related to nerve damage, and also binding to other proteins. So for example, there can be binding to the clotting factors in the blood. This can trigger blood clots. It can also strangely lead to an increased tendency for bleeding. Now, another rather strange effect is that these abnormal proteins can stick together and build up in different tissues. There can be issues of buildup even behind the eye, can affect vision. There can be effects on the heart. There can be effects on muscle tissues. And so there can be very, very strange effects from myeloma protein buildup and binding. And so the bottom line for this patient is that there is an extreme need to be aware that issues can emerge related to the abnormal protein, and any strange findings, effects on kidneys, effects on nerves, effects on hearts, need to be considered. And so one does need to be alert and aware that those are problems, and that even therapy might be required and needs to be considered to get rid of these abnormal effects. So for example, if there's kidney damage or nerve damage, steroids can be used. That means we could use treatment with prednisone or dexamethasone, which can reduce the inflammation and can reduce the impact of monoclonal proteins binding to tissues. And so MGUS is benign in the sense that it's not an active cancer. There is no multiple myeloma present, but the ongoing production of monoclonal protein is not without danger, and we do need to be alert with that and to be aware of it, and even be aware that there could be a need for treatment to try to block these different side effects.